Welcome to Teal Talk, an ovarian cancer podcast from the National Ovarian Cancer Coalition. Here, experts, survivors, and advocates share knowledge and inspiration for every step of your journey. Subscribe and follow us on social media at NOCC National. This episode is brought to you by Natera, Foundation Medicine, and supporters like you.
Imagine if a simple blood test could detect if your ovarian cancer was coming back months before a scan ever would. Now imagine if a blood test could detect cancer even before it's been diagnosed. That's the promise researchers see in liquid biopsy. And today we're diving into one of the most exciting areas in ovarian cancer research, blood-based testing, often called liquid biopsy. In this episode, we'll explore what liquid biopsy is, why it matters, and what it could mean for future early detection. To help us understand this more, I'm joined by one of our Medical and Scientific Advisory Board members, Dr. Hardesty, with Alaska Women's Cancer Care. Dr. Hardesty, thank you so much for being here.
Thank you for having me. I'm happy to be able to come and talk to you.
Absolutely. So let's just get started. So we hear the term liquid biopsy. It sounds so interesting and so intriguing. Can you tell us a little bit about what liquid biopsy is?
Absolutely. So basically, liquid biopsy is a blood draw. And what happens is after that blood draw, the scientists are able to do analysis and actually find little fragments of DNA floating around in your circulation that come from the cells in your body that are not alive anymore. So the easiest way, I think, to help explain this to people is there is a place in healthcare right now where liquid biopsy is well established and used all the time, and that's actually in prenatal care. So it turns out if you're a pregnant lady that you can go and have a blood test about 10 weeks in your pregnancy, and they can find your baby's DNA in your blood, and you can tell if your baby is a boy or a girl, if it has trisomy 18 or some of these other really severe birth hereditary genetic defects. And so the same concept is now being looked at in cancer. So you can take a vial of your blood, and cancer cells are DNA different than your regular cells. And that's the definition of cancer, is a cell that's changed. And the way it's changed is that the DNA is changed. And so they don't look the same. The instructions are different for those cells and other cells. And so researchers are able to determine whether or not those cells are present or absent. So that's basically the concept between liquid biopsy.
Okay, so if I make sure I understand, so basically it's cancer cell fragments or DNA fragments of cancer cells that are
Correct.
floating in the bloodstream.
Absolutely. And they don't look the same as the DNA in the rest of your body. I always explain to patients your DNA is like an encyclopedia, right? It's like this book, War and Peace, very big book. Cancer cells is like that book, but let's say I'm going to rip out some of the chapters and rearrange them, or pull a few pages out, or put a black line through some of the words. And so the book looks different. And so researchers have the technology now to be able to say, hey, these are DNA, this is DNA from her cancer cells.
Wow, that is awesome. Okay, cool. And I'm going to actually ask you why that's important in just a minute. But what I wanted to ask you next, now that we understand that, is how is this testing, or what we're looking at in this testing, how is that maybe different from what we hear a lot about the marker CA-125 in our blood, as I'm sure a lot of patients are very well familiar with? How is it different than that?
Yeah, cell-free DNA is looking at DNA, or circulating tumor DNA is looking at DNA. CA-125 is one of a number of proteins, and those proteins, which are not DNA, are circulating in the body and made by different cells. And it turns out that ovarian cancer, which is most commonly in the abdominal cavity, the cells in the abdominal cavity make this protein called CA-125. And so if you find high levels of this protein, it often correlates with the presence or recurrence of an ovarian cancer.
Okay, so CA-125, that's a good way to put it. It's a protein that we're looking at versus DNA.
Right. But if I got a burst appendix and there was a lot of infection or nasty stuff in my abdomen, if I drew a C125, I wouldn't be surprised at all if it was 500. So any kind of inflammation or irritation in the abdominal cavity or endometriosis or a whole bunch of benign things can also cause excess CA125. So it can, as a screening test, that's why it fails, CA125, and not all ovarian cancers are associated with elevated CA125 levels.
Okay, that's very helpful to realize what the difference is. So thank you. Another question about the difference between liquid biopsy and some other things that we hear about a lot is, can you tell us how maybe a liquid biopsy, again, I'm saying this and I'm repeating this so that I can make sure I understand. But can you tell us how liquid biopsy that's looking at circulating tumor DNA in the blood, how that DNA, looking at that DNA in the blood, how is that different from genetic testing DNA?
So genetic testing goes back to that whole thing about the book and the encyclopedia that we were talking
Okay.
about. So when you're born, all the cells in your body have a certain DNA, their book. This is the book for you. And every cell in your whole body has that same instruction set unless something turns into a cancer later on down the line. So when you're doing genetic testing, there are really two types that we do in cancer. We do genetic testing for you, every cell in your body. Those are hereditary things. This is your BRCA1 and 2 mutations. You're born with this, and it's a situation that has a higher risk of eventually you developing cancer. And then there's your tumor genetics, because remember, the book of your tumor is not the same as the book of the rest of your body, right? It's been changed. And that's what makes it a cancer cells. The DNA is changed. It's mutated is the word that's used. And so that's also done. And that's a different thing as well. That's actually taking a little piece of your tumor and looking at how the DNA is on that. And then the other thing is a circulating tumor DNA, which is looking similarly at the tumor specifically the DNA specifically of the tumor.
Of the tumor. Okay, awesome. So DNA of your hereditary DNA is different than the DNA of your actual tumor. And that's
Correct.
that is sometimes a hard concept to understand and get straight, but that makes a lot of sense.
It's a hard concept for educated scientists who aren't lay people. It's very easy to get confused about it. So that's why I try to do my sort of simple.
I love the book analogy.
The books and that sort of thing, because that's a helpful way for people to understand that.
Yes, it is very much. I love that. Thank you for sharing that. Absolutely. Okay, so why then, now that we've established what liquid biopsy is, looking at circulating tumor DNA in the blood to give us some insights, why is this, do you see, important for ovarian cancer now and maybe even moving forward?
Yeah, I think that there's many ways in which it can be important. I think that right now we're looking at it is in patients that are known to have ovarian cancer as one of our tools for potentially detecting recurrent disease or deciding whether or not there's evidence of ongoing disease. This might help us make decisions about what we're going to do with different medications that people might be on in terms of chemotherapy and things like that. I think that we're all very excited about the concept of using this as a tool for early detection, because at the end of the day, what we really need at ovarian cancer is to be able to find it before it's stage 3 and 4 so we can have better outcomes for people. And that is difficult because of just the way ovarian cancer grows in bodies. It tends to do so on surfaces and it's hard to detect. So the promise of that for these hard to detect cancers as potentially being able to identify it in circulating proteins, that's very exciting. But that is, as of yet, not mainline or has not been established, but it's definitely being looked at.
That's really exciting. Yeah, we're not there yet, but that is just really exciting to know that could be hopefully future one day, like you said, on the horizon. That's really exciting. Thank you for that. And I think you've already alluded to this, what I was going to ask you. So what's next? What's next in this area of liquid biopsy, looking at the blood, at different things? But I think you've said it very well that we're seeing a lot of promise for this in the future.
I think what where it's starting to mushroom cloud right now, I think that scientists have partnered with some of these companies to use these tools in clinical trials. And I think this is where you're really going to see this gathering steam, is that we've got lots of new drugs. We have lots of new strategies. For example, for ovarian cancer, we have definitely moved into much more aggressive maintenance type of drugs where we used to just treat people and then we would take a break and then cancer comes back and we would treat. And there are situations where we do that, but we find ourselves, I think, using more bridge therapies or maintenance therapies and things like that. And those have side effects. Those are not financially, they're expensive. There's a lot that goes along with doing that, and having better tools to be able to tell what's going on with somebody's cancer can really guide us. And there's definitely been a couple of exciting trials that have come out, for example, using colon cancer as an example, because I think that they're a couple of years ahead of GYN cancers in terms of the research that, now that it can be a tool to identify who needs maintenance therapy and how long they need it.
Oh, wow.
And maybe there are some patients that don't need that, and we can avoid the costs and side effects associated with some of these maintenance therapies. Because if any of your listeners have been on some of these maintenance therapies, it still has side effects. It's not nothing. And I think that's probably the area in which we're going to see it incorporated first, is going to be
Okay.
guiding some of these therapies and identifying potentially a higher risk subpopulation that is continuing to shed, that needs these therapies. It needs a more aggressive maintenance approach. We're certainly seeing that in some of the other cancers. And so I think that'll probably be where we see it incorporated more routinely first.
Wonderful. Okay. Very helpful. In what situation would this test be most helpful? And really, I guess, who should really be thinking about this type of liquid biopsy testing?
Yeah, I think that for me clinically, when I think about my ovarian cancer patients, because I will definitely say that I have been using this technology pretty aggressively because at the moment, depending on the company, a lot of them are offering this test in such a way so that if it's not reimbursed, the patient does not have a financial obligation. In other words, like if it doesn't get paid for by their payer, the patients are not receiving bills. And so because of that, I was able to use it a little bit more broadly at first, not because I just think everybody needs every test under the sun, but really because I wanted to say, where is this information helpful? How, under what circumstances does it change clinical decision making? And I really feel like, especially for women who don't have a good marker, because I would say probably about 30% of my ovarian cancer patients, the CA125 is not an informative test. When the cancer moves out of the abdominal cavity, sometimes we get so good at treating in the abdominal cavity, we see patients whose disease is, say, for example, more isolated in lymph nodes, and those patients tend to have C125 as a less informative marker. In a perfect world where cost was nothing and we could just do whatever we wanted, we would get PET scans on everybody and
Yes.
circulating tumor DNA and do all these things, but that's just not a real world. I think when I say what's the most bang for the buck here, it's really going to be patients that don't have a good marker at baseline. If you've got a C125 that's correlated beautifully with whatever's going on with your disease, and I'm not sure at the moment where we're at with cell-free DNA is going to add much of that. And then the other thing I will say that is another area that is just being looked at as we get more and more targeted therapeutics, and by that I mean it's not just a drug that you give and it goes to every cell of your body. Now what you're seeing is new kinds of medicines that are called antibody drug conjugates, and that's like a drug that's attached to a smart bomb, so it delivers it to certain cells. And those are often related to certain DNA expressions in your tumor. In the future, there could be a situation where you would get a blood draw to see what your tumor's book looks like, right? And then, but here's the tricky part. This is where this gets confusing. The cancer is a dynamic thing. So the cancer's book changes over time, especially as you get chemo and whatnot. So it could be that it was expressing certain things at one point and now it's not later. So a liquid biopsy, another place where that can be used is like 3 years into your cancer journey, looking again at what your tumor's book looks like to see, do you have the kind of changes that might make a certain medication work better? And so I think that is the most novel place, and that is, we're very early in that. But that is also another place where I think that potentially if we're looking to see, would this drug work well in this particular patient, let's do a blood test to see if her tumor has the protein or the expression, the DNA that would lead to that protein for a certain drug or treatment.
Wonderful. I think you've done a really fantastic job, Dr. Hardesty, at explaining to us what liquid biopsy is, what it's looking at, the circulating tumor DNA versus other markers and things that we hear about on a common basis. So you set that straight. Thank you so much.
Yeah, no, my special power is translating it into everyday world examples.
I love the book analogy. It's a wonderful one. And I think you also touched on, too, the promise of the future, that this would be a great way, hopefully, in the future that we can find things maybe as early and fit that gap that we have with screening. So really, really exciting. Thank you so much for spending this quick time with us. We really appreciate it.
Thank you for having me.
Thanks for listening to this episode of Teal Talk. We'd love your feedback. Take our quick survey linked in the description or drop a comment with your questions and topic suggestions. For more information about the National Ovarian Cancer Coalition and our mission, visit ovarian.org. Until next time, stay informed, stay empowered, and take care.